All right, well, welcome everyone. Today, we want to talk about one of the most important things that you'll do for animals coming into your shelter, and that is intake. I am Dr. Erin Katribe. I'm the Director of National Veterinary Programs for Best Friends. And in this role, I work with our National Shelter Medicine team, and we work with shelters across the country, as well as support Best Friends lifesaving centers also across the country. And disease prevention, intake, everything shelter medicine. That's our bread and butter. And we are just so excited to talk about this important topic. A couple of housekeeping things. You should have access to the chat box as well as the Q&A. Use the Q&A box for any content questions that you have. And the other veterinarians and technicians on our shelter medicine team can work on answering some of those questions as I'm talking and going through the content. If you have input on, you want to answer some of the questions I'm asking the group, then that's where you use the chat box. And there'll be some specific things that I ask around for you to put into the chat. And so if we want to, we can start with, I'm interested in where folks are from. So drop in the chat box where everybody is from. So what organization you're with and what city you're in. And as we get started, so let's see, I have Idaho. Where else, y'all? Let's see, Yuma in Arizona. Excellent. I know I see some Best Friends staff on here too, which is fantastic. Atlanta and Utah. Excellent. So we have a pretty wide spread across the country, which I think is exciting. Awesome. Folks in Arkansas representing. Excellent. All right, so I'm gonna go ahead and get rolling. So what you do at intake plays such an important role. What you do at intake protects pets from deadly diseases. It helps pets heal. So for those pets that come into us sick or injured, the things that we do starting at intake is critical to getting them on that journey to healing. The steps that we take at intake also start pets on the path to a live outcome. And when we talk about time spent in the shelter, every single day extra that they spend in the shelter, that matters. And so what we do at intake should be the steps that set in motion, getting them on that pathway to their live outcome. And ultimately, keeping them healthy, helping them heal if they need it, and that path to a live outcome, that is what saves lives, both for that animal in front of us who's getting the intake, but also doing this efficiently. That's what allows animals to keep moving through our shelter system, and that's what allows us to save even more lives. So what are our goals for intake with that in mind? What exactly are you trying to achieve? And that's going to be assessing for urgent medical needs, injuries, illness, contagious disease that could affect other pets. It's going to be intake treatments that help prevent disease. We want to be efficient. In some of our shelters, we're taking in tens of animals, even over 100 animals in some situations. If you can, put in the chat, how many dogs and cats are you taking in on a daily basis? We have to be efficient. And then, of course, again, getting that animal on their path to a live outcome, taking steps toward that outcome, because that live outcome is what we want for all of them. So what exactly is included in an intake? And we'll dive into all of these in more detail today. So one of the things is going to be a physical exam by trained staff. As we'll talk about, this doesn't have to be a veterinarian. It doesn't even necessarily have to be a technician, just has to be staff that are trained to do that job. We want to scan them for a microchip and assess for any other potential identification that could mean there's an owner that we can try to contact to get them reunited. We do our vaccines. We want to give those immediately, not days certainly, and ideally not even hours later, but give them right away at intake or even before intake if we have the opportunity. Deworming. So we have some preventative deworming recommendations for all pets that we'll talk about. Screening tests, and I have a plus or minus here because this may or may not be something that you elect to do. And so essentially what we're talking about here is heartworm tests for dogs. And I have on here FELV, FIV testing. And we actually no longer recommend routine screening of all cats in the shelter, which we'll talk about more in detail later. And then again, back to this pathway planning. So really figuring out what pathway to a live outcome is this animal going to be on, and taking those initial steps to make progress toward that outcome. So let's start with that physical exam. Now, again, this does not have to be a vet or even a technician. This just has to be staff that are trained to do this. So usually they are trained by a veterinarian or a technician. What are we looking at? And we're looking at basic things. We're collecting a weight. We're looking at their body condition score. So are they, very fat, very thin? Do they have any ocular or nasal discharge? Checking in their mouth. Basic assessment of hydration. Are they having any trouble breathing? Right, that can be an emergency, which we'll talk about in a little bit. Limping, any hair loss or obvious parasites. Skip the temperature. We do not need to stress them out unless there's a reason, unless they're sick. So unless they're showing signs of illness, we don't actually have to do a temperature on all of them. Now, we're talking about potentially really high numbers of intake, 10, 20, 40, 50. I deal with shelters sometimes that have 70 or 100 animals that are taken in every day. And so when we're talking about this exam, this should be really quick, less than a minute, including intake treatments. We're talking 2 to 3 minutes per pet in a lot of situations. And we're actually going to have a resource for you that shows what that quick intake exam and intake treatments look like in our resources. So those are the things that we're looking at, but what are the big things that we're looking for that might require attention right away? And so what are our exam priorities? And these are some of those things. So again, urgent medical. So we're really any emergent illness, so pain or severe injuries. Potential identification. If we can put this animal, if we can figure out that they are lost and not actually stray, if they have an owner that we can reunite them with, again, every extra day in the shelter matters. And so if we can start that process, that's going to be really important. And so we want to look for anything that could indicate they have an owner that we can get them reunited with and scanning them for that microchip. And then identifying infectious disease. Isolating pets that are showing signs of potential infectious disease. And the goal here is we want to prevent exposing other animals. Okay, so what are some signs of infectious disease? What are the things that we're looking for? Things like ocular discharge, hair loss, nasal discharge, vomiting or diarrhea, especially with blood in it. These are all signs of infectious disease that we want to look out for, and some more hair loss too in that dog. What things are medical emergencies? And when I say emergency, I mean, what are things that we need to address right now, not tomorrow, like things that must be addressed right now. If you have a vet on staff, then we need to go get that vet right away. If you don't have a vet on staff, these are things that we need to seriously consider sending to a private practice veterinarian right away. And if we don't have the bandwidth to do that, do we have partners that can take them right away that we can transfer them to? And if that's not an option, these are also potentially cases that we can consider making some euthanasia decisions on. So what are true medical emergencies? If we have trauma where we have things like exposed bones, if we have cases where there is severe and significant bleeding, we have really, really deep wounds or potentially wounds that go into the abdomen or to the chest. Those are some potential emergencies. And this is an actual case that I saw at a shelter. Severe illness. So things like seizures that are long lasting or neurological signs, those are going to raise some red flags that they need an evaluation. Are they jaundiced? So like what yellow color to their skin or to their gums, or just very pale or very white gums. If they're not responsive, so if they're laying and not reactive when we try to stimulate them, and then potentially facial swelling. What we're after here is significant facial swelling where we're concerned about their airway becoming obstructed. So here's a picture of a cat that is showing, so that yellow tinge. There's a really, really, really pale dog, and then some facial swelling. And then the last category I have on here is respiratory distress. So really any difficulty breathing. So very labored breathing, a lot of effort, a lot of abdominal effort. If it's really, really fast, or if you see what we call cyanotic, which is blue gums or tongue, or almost this like purpley muddy color, like you can see in this picture here. So all of these things, and this is not an exhaustive list, but these are, like if we see these things, this animal needs to get evaluated by a vet as soon as possible. So don't wait. All right, what else are we looking for in our intake exam? And that's going to be age and sex determination. As I'm sure all of you have experienced, puppies are a little bit more straightforward. And so you can see pictures of both a male and a female puppy there. When we get to cats, it can sometimes be a little bit harder, especially if they're young kittens or neutered males, if there's not obvious testicles back there. I ask, please spend a little bit of time here though. Do not let your veterinarian try to spay a male cat. It's not something that I enjoy when it lands on my surgery table. So you can see in the pictures on the top right, so the male kitten, there, it almost looks like two dots, and there's more space in between the anus and then where their little prepuce is. On the neutered male, so that gray cat, it's a little hard to see. It's not well lit, but you can see again, there's a lot of space there. If this were a Tom, that's where those testicles would live, but obviously he's been neutered already. The female kitten looks more like a dot and then a little line, and it's much closer together. And so you can see that in the blue off to the side. So comparing that male to the female. Reproductive status. If we can identify that an animal is spayed or neutered already, that's one less thing that we have to do. And that can potentially shave days off of their length of stay. So if they are spayed or neutered, let's try to identify that. And so ideally we have a tattoo. This is a great reason to tattoo if you have spay neuter programs. And we can find those tattoos in a number of different places. So in females, it's usually in the middle of the abdomen, close to where that spay incision is. On boys, it sometimes, on male cats, it might be in that same spot, or it can be next to the scrotal sac, which you can see in that left-hand picture. And then in male dogs, it's usually off to the side, near the scrotum, in what we call the inguinal area, so in that groin area. Sometimes we have a green line, but other times we have a symbol. And sometimes if the ink is black and you have a dark colored dog, then that could be a little bit challenging to see. I recommend shaving, but you can see some different options there that we might find. On cats, we might see things like an ear tip, or if they don't have a tattoo, we might be able to find a spay scar. There are certainly other reasons why dogs can have abdominal surgery. But for example, in this picture, and I'll zoom in a little bit, I'll show you a close-up. This is a very large dog. This was a German Shepherd mix. She had a lot of tartar on her teeth, so she's definitely old. And you can see she has this very small scar and not a lot of mammary development. And so for me, there's a really good chance this dog is spayed. Now, it's up to your vet or to your shelter policy to decide what to do with this. There's many situations where I would be comfortable adopting this dog out with a waiver that says, hey, we found the scar. We think she's very likely spayed. Call us if she goes into heat. And that is certainly an option, because what I don't want to have to go do is go in abdominally and do a surgery to try to verify that. But again, every shelter is different. But for me, in this particular instance, I would be comfortable calling her spayed, and you can chat with your vet about what their comfort level is there. All right, age determinations. So for kittens, we have this, you may have heard, this 1 pound per month rule. So 1 pound kitten is about a month old. And that's accurate for about the first probably 3 to 4 months. It can be really variable though. You can find charts that let you look at their teeth. And so their baby teeth come in and then their adult teeth come in on a regular schedule. But I will tell you, for kittens, I think that using charts like this one with mobility and just looking at their general appearance, looking at how, are their eyes open? Are their ears still folded down? How mobile are they? How wobbly are they? I think that looking at that general appearance and that mobility, I think is a lot more accurate. Their size can be really variable depending on what their nutrition has been. And I just find this is a lot easier for shelter staff than trying to look at their teeth. So for kittens, we have there's several excellent charts like this that you can reference. For puppies, it's a little bit harder just because they also, because of breed differences, can be really variable. But we have this one resource. There are many out there that looks at development and when those baby teeth and then those adult teeth are coming in to help you estimate age on puppies. When it comes to adults, it can be a little bit more challenging. Once all of those adult teeth are in, we're left with looking at tartar development on those teeth. And so you can see on the left-hand side, so essentially no tartar. And so this dog we know is at least 6 months of age or older, based on the fact that all the adult teeth are in. And then after that, it gets really kind of fuzzy. And so just like in humans, the development of tartar can be really variable, and it depends on breed, and it depends on if they've got any dental care. But I would call that upper left-hand dog, I would call that dog probably in the 9 months to a year of age. The next dog, so on the lower left-hand side, that one's probably in the 1 to 2 year age. And then we get older as we go, right? And until we develop a whole lot of tartar, indicating that dog in a large breed dog, I would age it at maybe 8 to 12, but you can see we get a really wide range when we get into those situations. All right, what about a Woods lamp exam? So a Woods lamp exam is checking for ringworm. Many shelters elect to do this with all cats at intake, and that's certainly an option depending on what your population is, depending on how much ringworm you're seeing. And so we do that. That screening test is going to be with a Woods lamp exam. When we are selecting a lamp, it's important to get one that plugs in, and ideally one that has magnification. You can see in that picture the magnification there. And there used to be this myth that we needed to let the lamp warm up. And in fact, that's not actually the case. But what we do need to do is turn it on and turn the lights off and allow our eyes to adjust. Because sometimes if we don't have a lot of fluorescing hairs, it can be really challenging to see. So here's a picture of a positive Woods lamp exam. And so you can see each individual hair is fluorescing, and it's that apple green fluorescence is what we call it. And again, it's those individual hairs that are fluorescing. So don't get tricked. There are other things that can be on the cat's fur that will fluoresce, things like doxycycline, certain eye medications, dander, or even skin crusts. My recommendation for you is ringworm doesn't wipe off, right? So we can get a damp cloth and we can attempt to wipe it off. If it's really ringworm, it's not going anywhere. That pigment is deposited in the hairs. And so if it's ringworm, it's not going to go away. There was also a myth that I still hear that's circulating that only half of ringworm is going to fluoresce, and it's actually not true. It's greater than 90% of microsporum canis, which is the typical one we see in cats. Greater than 90% of it fluoresces under the Woods lamp. So this is a really good and very accurate screening test. Microchip scans. So many animals, right, that come to see us, they come in as a stray intake. But how many of those animals are not in fact stray, but they're just lost? We want to get them back home if we can. And ideally, the first time this scan happens is with our field officers when they're in the field, and they don't even have to come into the shelter. But if it hasn't happened then, or if perhaps they come in over the counter, the microchip scan is going to happen first at intake. Our key for microchip scanning is to use this strategy. So slow. We don't want to rush through this. We need to be close to the skin. We want to cover this whole area. And you can see in the picture here, it's a comprehensive microchip scan. These can migrate really far, especially in bigger dogs. And so we want to make sure we have the best chance at finding a chip if it's there. And so we use that whole area. And then next steps, if a chip is found, what do we do? And so we can use the National Registry lookups to determine, to try to locate that owner and to reunite that pet. All right, so I'm about to have a poll for you. It's going to be around this case example. So we have a 3-month-old female mixed breed puppy who comes into the shelter. She comes in, somebody found her out on the side of the road, and they bring her in. And our intake technician is doing her exam and finds some very pale and very tacky or sticky mucous membranes. She has what we call a prolonged skin tent. So we tent up her skin and it doesn't bounce right back. So we are worried about hydration in her. And gosh, she's really quiet. Maybe even I would call her depressed. So she's not active and bright like we expect a puppy to be. And so here's our first poll. What would you do next? Vaccinate the puppy? Put the puppy in a stray holding area and get medical immediately? Put the puppy in an isolation area? Or both A and B? Or both A and C? Let's see, I have some answers coming in. All right, I'll just give it a second, couple more. All right, we'll go ahead and end. We'll share the results with everybody. So some of you would have done, let's see, so just put her in the stray holding area, go get medical. One of you said isolation area, and a couple of you are gonna do vaccinate as well as do those things. We will come back to this and I will share with you my answer when in a few slides. Now let's talk about vaccination. These are our most important key points when it comes to shelter vaccination. And we'll go through each of these a little bit more. We want to vaccinate on intake. This is probably the most critical part of our intake. If we have the ability to vaccinate even before they come into the shelter, then that's even better. We want to choose modified live vaccines. We'll go through some different vaccine types and how to determine this. But if we have the option to use a modified live vaccine, that's what we want to pick. We want to vaccinate according to a shelter-specific schedule. This looks different than what an owned pet going to a private practice is going to receive, and we'll talk about why. And then we want to make sure we're storing and handling our vaccines appropriately, as well as using our medical records and reminders. So getting these vaccines on intake, as well as getting their additional doses in on time, is going to be critical to reducing infectious disease in our high-risk shelter populations. So what are those shelter guidelines for vaccination? For DHPP for dogs and for FERCP for cats, we start by 4 weeks of age, or even sooner. Many shelters now are starting to explore vaccinating before 4 weeks of age. We'll talk a little bit more about that, but essentially, we don't have significant evidence of adverse reactions. And what we do know is there is a very real risk of parvo and panleuk in so many of our shelters. And so again, this is something that our team is starting to recommend in shelters where there is a high risk, and many shelters have been doing this successfully. Interval between doses. So we're going to continue to give booster doses for our juveniles, and we're going to give those every 2 to 3 weeks until they're 18 to 20 weeks of age. So I typically will just say until 20 weeks of age to make that simple. And even adults are going to get an additional dose. So they come in, they get their intake vaccine, and even adults are going to get a second dose in 2 weeks. For dogs, we also give Bordetella and parainfluenza. We recommend an intranasal version of this vaccine, and we're going to give that at intake just once, typically 4 weeks of age or older. Some of these are actually labeled at 3 weeks, and that's okay, but definitely by 4 weeks of age or older. It is important to give the intranasal version. We don't want to give the subcutaneous version, and we don't have as much data on the oral vaccines. And so giving that intranasal vaccine is actually what we have the most evidence for, and we know is very effective. Maybe rabies. We ideally give rabies before they leave the shelter, but they're not at risk of getting rabies in the shelter. And so this one is one, ideally we give it before they go out into the world, but maybe it's not something we have to worry about at intake unless from an operations perspective, that makes sense for you. And ones that we don't routinely recommend are chlamydia. So you can see on this here, this FERCP also has a chlamydia component that you don't need. We don't need to administer that. Canine influenza is another one. Even in shelters that have experienced influenza, this vaccine takes a really long time and multiple doses to work. And so we don't actually recommend giving that in the shelter setting. And then I have lepto on here. So some recent updates to guidelines came out actually saying that lepto should be core for all dogs, including shelter dogs. But those of us in the sheltering world, this is still, we're looking into this, and there's a task force that's going to work on this. I don't know where we're going to land. Essentially, the big question is, are they at risk of this in the shelter? This is something to have a conversation with your veterinarian about, whether this is appropriate in your shelter. But I suspect it's going to be a risk vaccine and not necessarily appropriate for every dog in the shelter. All right, so I said to use modified live vaccine. So how do we know we're using the right type? And the way that you know is it will say modified live virus right there on the package. And so this is just one example. There are obviously many vaccine manufacturers. We'll talk about some different things to look for, but this is an example of a DHPP that is a modified live virus. And so you can see it's right there on the box. All right, here's another vaccine. So this one's a Bordetella vaccine. What about this one? Is this a modified live vaccine? And you can see it says some other things on there, but it does not say a modified live. And so no, this vaccine is not. What about this one? And so you can see this one says modified live virus, but it also says canary pox vector. Oh my gosh, what does all that mean? And I said we're looking for modified live, but it has that other thing on there. And so that is a different type of vaccine. And this is something that I would recommend you talking with a veterinarian about. But this other thing, this is in reference to the distemper component. In this particular vaccine, the distemper component is not modified live. And there's some other clues. So here's another example, and you can see it has canary pox vector. A vectored vaccine is a different type. It's called a recombinant type. Again, that's just the distemper component. And so maybe if you don't have any distemper in your world, in your area, that's okay. The modified live part is the parvo. Another clue, the trade name for this particular vaccine happens to be a recombitech, which means it's a recombinant vaccine. But again, it's this sort of next level understanding about vaccines actually becomes really important because we do see disease associated with this vaccine. The antibody response, the immune system's response, it's slower with the administration of this vaccine. And so if canine distemper is something we're worried about, then that can be a problem in high-risk shelters. This is an example from a shelter in Texas that actually routinely sees distemper coming in from the community. And we see this in a lot of places, especially across the South, but it's because of either community disease in the dog population or because wildlife can be reservoirs for this. And this is a shelter that actually experienced a recent uptick in disease. And we actually believe this is related to those recombinant vaccines. They work, and they work well, but they work really, really slowly, too slowly. Even with the right type, with a modified live vaccine in the shelter, sometimes adult dogs take until well after their second dose to become protected. And so when we see dogs, even with the right vaccine, that are exposed in the first couple of weeks in the shelter, they become sick. With recombinant vaccines, that protection can take 4 weeks or even longer. And so they're just too slow for high-risk shelter settings. And then we're talking about adult dogs with puppies, which we'll talk about next. All bets are off because it can take even longer, right? And so the key point here for these vaccines, modified live vaccines, whenever we have the option, including for the canine distemper component, if that's a disease that you're concerned about. All right, so let's talk about vaccinating young animals. When puppies and kittens are born, if their mom had either received vaccination or had actually gotten infected, the mom makes antibodies and she passes those antibodies, some of them, onto her puppy or kitten. And so they may provide early protection for that puppy or kitten. I say may because if mom was never vaccinated or if mom was never exposed to those diseases, then she won't have any antibodies to give them, and that puppy or kitten won't have any protection. The challenge is that if maternal antibodies were passed on, they can interfere with vaccination. Maternal antibodies decline with time, though. However, how fast they decline is really unpredictable, and it can be different, even for different puppies and kittens in the same litter. So maybe they get protection from mom, but that protection that's going to go away at some point interferes with our vaccines. Our vaccines provide long-lasting protection once they have a chance to kick in, but we don't know when those vaccines are effective. One thing we do know, the latest that maternal antibodies hang around is 16 weeks of age. So if a puppy or kitten gets maternal antibodies, the vaccines that we give at 16 weeks of age or later are going to be effective because all of those maternal antibodies will be gone. Now, again, if that puppy or kitten didn't get anything from mom, maybe those vaccines that we give at 4 weeks of age are effective, but we have no way to know. Common scenario. I hear this in shelters all the time. This 10-week-old puppy has had 3 vaccines. So he's protected. We don't have to worry about this. He can go out into the world. We don't have to wear gloves anymore. He can go interact with other dogs. And is that true? And the answer is no. We don't know for sure that he is. If he had a lot of maternal antibodies, all of those vaccines were going to be inactivated by those maternal antibodies. And those maternal antibodies that interfered with the vaccines that we just gave could go away tomorrow. And he won't be protected by maternal antibodies anymore. And he's not protected from vaccines. And so what it boils down to, we don't know for sure that young animals are protected until they've had 2 vaccines, both given at 16 weeks of age or greater. And so what that means in practice, they're at least 18 weeks of age and have had those 2 vaccines. This means we have to handle them as if they are vulnerable to catching disease and as if they could develop disease at any point, right? And that's disease that they could potentially spread to others. The number of vaccines that they've had in total does not matter. If we start vaccinating them at 4 weeks and keep going to 20 weeks, that's 9 vaccines. If we're using neonatal vaccination, that could be 10 or 11 vaccines. But we don't know for sure until they reach 18 to 20 weeks of age and they've had those 2 doses. So who in the shelter environment gets vaccinated? And so I want you to all put in the chat. We're going to start on the left. So first we have a 4 to 6 week old puppy and a 4 to 6 week old kitten. Are we going to vaccinate them on intake to the shelter? Healthy, bright puppies and kittens. I see lots and lots of yeses. Excellent. Yep, we sure are. We are going to vaccinate them. One question that comes up is, well, how do we know if we're using a 4-week vaccination guideline? How do we know? And you can see on that picture, so the sharp pointy teeth, the canine teeth, the next teeth that come behind that, those premolars, if those have come in, then that puppy or kitten is old enough to get those vaccines. Now, we'll talk more about this, about how we're aging them and how critical this is when we go around the circle. But next, let's talk about on the bottom. So we have a pregnant cat and we have a cat that's nursing. Are we going to vaccinate them? And I have lots and lots and lots of yeses, which is excellent. Yes, we are going to vaccinate them. You may encounter, it's definitely out there in the veterinary profession. And so this might be something, especially if you're utilizing a private practitioner for any of this, was some thought that there was this risk of cerebellar hypoplasia by vaccinating pregnant moms or vaccinating with young kittens. And I'm happy to talk more about that or to even have those conversations with those vets. This is really a theoretical risk. We don't actually have a documented case report where we know this is what happened. And what is not theoretical is the risk of Panleuk in our shelter populations. And so we definitely want to vaccinate this mom in these situations. All right, what about the puppy and the kitten on the right-hand side? So some upper respiratory disease in both of these. Are we going to vaccinate them? And I see lots and lots of yeses again. Excellent. Yes. So we are going to vaccinate even in the face of disease in the shelter setting. And again, the reason for this is because they are just such at high risk of exposure to infectious things. And so in this particular instance, yes, they have upper respiratory disease, which hopefully we can treat them for, they'll get over. And that would be the worst thing for them to get parvo or Panleuk afterwards. And then the last one I have for you is the neonatal puppy or kitten. So say these are 2 to 3 week old puppies and kittens. Are we going to vaccinate them on intake? Have a yes. Answers are trickling in slower. I have a no. And so the answer here is maybe. This is not yet in any published guidelines, but it is something that we're recommending for shelters where these puppies and kittens have to stay in the high-risk shelter setting. Now, ideally, we get them out to foster, and so they're not at such a high risk. Like many things in sheltering, this is about risk versus benefit. And if there's a meaningful risk of disease exposure, it's definitely worth considering. What we don't have evidence of is significant adverse reactions, even from the shelters that have been doing this with hundreds or even thousands of animals. And so it is definitely something that we're looking at in a lot of shelters. So who gets vaccinated? Nearly everyone, maybe everyone. So back to our case example, this is what I would do. I would vaccinate this puppy. I would go ahead and do it. I'm worried that potentially this puppy has parvo. That's my biggest concern. So I want a parvo tester. If she does have parvo, what would be the worst is for her to get over her parvo and then break with canine distemper or get exposed to distemper in the shelter. So I am going to vaccinate her. I am going to move her to an isolation area. What I don't want to do is risk exposure to other animals. And I want to disinfect everywhere that she's been. Parvo lives for a really long time in the environment. And so we need to make sure we're not leaving parvo all around our intake area for the next puppy that comes in to get exposed to. Now, this picture, this is an actual puppy coming into one of our centers. This was actually a bright, happy, bouncing off the walls puppy. So she was normal. You can see, though, my staff in this picture, she's wearing a gown and she's wearing gloves. And this is because even healthy appearing pets can actually be contagious. So parvo, as an example, is shed for some amount of time before they start to show clinical signs. And so whenever we're handling high-risk animals like puppies and kittens, and honestly, almost any new intake, we don't know what they were exposed to yesterday. And could they potentially be shedding infectious disease? And so we want to take extra precautions based on what that potential risk is. And for me, this is biosecurity precautions. So gowns and gloves with all puppies and kittens and all high-risk animals. Vaccine location. So where are we going to put these vaccines in this animal? And so you can see right rear for rabies on the dog and right shoulder for DHPP. Bordetella, we're going to use that intranasal version. And then on cats, so it's similar. So right rear and right forelimb. And ideally in cats, we actually vaccinate further down on the limb. However, I will tell you that if you have a cat that's challenging, it is more important for me to get the vaccine in the cat. And so yes, I do aim to get vaccines lower on the limbs. And I also aim in both dogs and cats to get vaccines in these general locations. But at the end of the day, the most important thing is to get the vaccine in the animal. And so if I can't do that, if it's a safety risk, if the animal is very, very stressed, I put the vaccine in the animal. Vaccine storage and handling. So what's critical is, especially for these vaccines that we mix up, but for all vaccines, we have to store and handle them properly. Otherwise, they're going to lose efficacy. So we want to keep them refrigerated. And gosh, shelters, we love these little dorm fridges because they're just so convenient, and we can put them in any area of the shelter, in our intake room, in our intake bay. However, we all know their temperatures are not super stable, right? They can freeze things every time we open that door, the cool air leaves. And so our vaccines may not be at that stable temperature, and that can be really problematic. And so what we actually recommend is a full-size fridge, or you can get these purpose-built lab fridges that are smaller, and we can still put them in all those great locations, convenient spots, but they are better and maintain that stable temperature. We recommend that you monitor the temperature, that put a thermometer in that refrigerator at the level of the vaccines. And if you take vaccines out into the shelter, put them in a cooler, not directly on the ice pack, but in a cooler with a little bit of insulation, so they stay cold while we're going out into the shelter to administer additional vaccine doses. For any of these vaccines that we mix up, they are only good for some period of time, 15 minutes to an hour or so. You can read the vaccine insert to see exactly what it says, but if I pull up a vaccine that's been mixed together already, I can't tell if that was mixed up 5 minutes ago or if that was mixed up 5 hours ago. And so for me, we mix them up right before we give them, and that's it. This image on the left, this is actually a kennel from a shelter that we consulted with that was dealing with a parvo outbreak and affecting puppies and young adults in that shelter. And you can see the bloody diarrhea there in that kennel. And this was indeed a dog that tested positive for parvo. And what we discovered in the shelter is that all of the animals were not reliably getting vaccinated on intake. And as we talk about, because of maternal antibodies, in puppies in particular, while our intake vaccines may take effect rapidly, they may not if that puppy has maternal antibodies hanging around. And so will intake vaccines protect every single puppy? No, not necessarily. We don't know. Adult dogs, though, dogs over 6 months of age, that first parvo vaccine can be protective in those older animals. And the dog that was in this kennel was a year-old dog. And so if this dog had been vaccinated for parvo on intake, there's a reasonable chance that this dog would not have become infected with parvo. And so this was a situation where, unfortunately, this dog lost its life. And doing things like vaccines right away on intake or even before intake can absolutely be life-saving in these situations. We've also dealt with other outbreaks related to vaccine handling. So things like mini fridges that are freezing vaccines or not keeping them cool. And so I just want to share, our team consults on lots and lots of outbreaks across the country of all kinds of diseases that affect, puppies, just like the one you see in the picture. And we do see outbreaks related to these practices. All right, next I have a couple other things on vaccines to share with you in terms of what kind of vaccines to buy and where we buy them is also important. And so that the vaccine on the top, so this is a vaccine that it is marketed directly to consumers. And so this is one that you can purchase at Tractor Supply. Anytime we have vaccines that go through Tractor Supply or any one of these other direct to consumer supply chains, what we don't know is how those vaccines were handled. And when I order vaccines from a veterinary distributor, I have confidence that they have been kept on ice, they've been kept on that appropriate temperature, they've not warmed up. I don't know that the vaccines that I buy from Tractor Supply have been stored and handled appropriately. And so that's the real question here. We've seen outbreaks that are related to uses of these direct to consumer vaccines that are obtained through these types of supply chains. And so I would encourage you, if you have the option to order through a veterinary distributor, then that's going to be the route that you should go, and choose one of the major manufacturers. If you are struggling with that, if you can't, and the only thing that you can get is vaccines ordered on the internet or from Tractor Supply, that is better than nothing, but reach out to us. We can potentially help, and we can try to help you find a veterinarian who, even if you can't order other medications, can at least help you get some vaccines. All right, so here's my next poll for you. For animals coming into your shelter that are under stray hold, do you vaccinate them, DHPP and FERCP? Your options are yes, regardless of stray hold. No, we only vaccinate if they're surrendered or they don't have that stray hold. No, we don't routinely vaccinate animals on intake, or we don't intake any animals or vaccinate any animals on intake. All right, I love the results I'm seeing so far. All right, I'm going to go ahead and share that. And so everybody says, yes, we vaccinate regardless of stray hold. And so that is excellent. I sometimes hear from shelters that they're concerned about either the expenditure of the cost of that vaccine if they don't know that animal's going to get a live intake. And what I say to those shelters is that the cost of an outbreak in terms of dollars, as well as the toll it takes on your staff and the loss of life, right? Like that outbreak is way more expensive than the cost of vaccines. Sometimes I also hear that animals under stray hold, they're worried about doing things to those animals. And what I say to that in that situation is, if I have an owner reclaim a pet and they're mad about that vaccine, I would rather explain to them why I vaccinated their dog to prevent that dog from getting parvo or distemper in the shelter versus the low, essentially next to zero risk of an adverse vaccine reaction. All right, next up we have deworming. And so we have some prophylactic, so preventative deworming recommendations. We give pyrantel on intake to adults and puppies and kittens. Puppies and kittens get that repeated several times, so usually at the same time as their vaccines. And that treats hooks and rounds. And then in most shelter settings, coccidia is such a huge problem in our puppies and kittens that rather than waiting for them to have diarrhea, by the time they show diarrhea, they can already have a significant infection. And so go ahead and give panazeral on intake and potentially even repeat it, depending on how much coccidia you see. We have a couple options. We can buy this equine paste and we can dilute it ourselves, or you can also just order this directly from compounding pharmacies. This is essentially the minimum recommendation. If you're seeing lots of whipworms or lots of tapeworms routinely in your shelter populations, you can certainly do more, but this is the basics for everybody. All right, feline leukemia FIV testing. So with this latest update of the retrovirus guidelines, we essentially were recommending that we shift FELV FIV testing from the shelter to the adopter. We're not saying don't ever test cats, but what we're saying is perhaps this is better done in a private practice setting rather than in the shelter environment. When we are testing every single healthy cat, a positive test is more likely a false positive, meaning we're labeling that cat with a disease that it doesn't actually have. And that can be really challenging for the shelter. Confirmatory testing is complicated. It's really hard to interpret. And so could we better use those resources for other things? We know, especially in kittens, that these results are really unreliable too. And so again, this is about resources and it's about where we're doing this test and where we're having this conversation. For the shelter, it makes sense. Let's focus our resources on other ways to save lives and shift that testing to the adopter should they choose to test their cat. So we no longer recommend testing all healthy cats on intake. All right, heartworm testing and prevention. So a heartworm antigen test for dogs over 6 months or 6 to 7 months of age. The reason for this is that heartworms are spread by mosquitoes. If a dog gets bitten by a mosquito today, they will not show up positive on a heartworm test until 6 months from now. And so testing dogs less than 6 to 7 months, they can still get heartworms, but they won't show up positive on that test. So we don't need to test them until they're older. And then ideally, we're doing heartworm prevention on all animals. So certainly this can be a risk-based assessment, but ideally we do this on everybody, including cats. And most of these products are labeled at 6 to 8 weeks of age or older. One thing I want to mention, if you can't heartworm test or you choose not to, you can still give heartworm prevention, and arguably you still should give heartworm prevention. Then the brand doesn't matter. There's some old information out there looking at different options for heartworm prevention, what we can use in positive animals and such. And the reality is use whatever you have, treat all animals, even if you can't test. Flea and tick prevention, maybe we're treating everybody. Maybe this depends on geography and season, but definitely we're treating animals with signs. And I would say some of the newer products actually also treat for things like mange. So for example, NexGard and Simparica. And so these, even though we probably won't use them on every single animal because of the expense, they're also great to have on hand. So you can choose to treat those animals with mange. They're excellent. They treat both kinds of mange, including the contagious kind. And what that means is we don't have to necessarily isolate those animals because they work so quickly. All right, next up, pathway planning. This is about thinking through from the point of intake how an animal is going to get out of here and what is the next step to make that happen. So here's an example of a little kitten. She comes into the shelter. She has her intake. She has her vaccines. She has her deworming. She does not have a microchip. What's her pathway? I would term her a fast track, meaning she is highly adoptable. We're going to put her on an adoption pathway, but we know she's highly adoptable and she can get out of here really, really, really quickly. So let's do all the things that we can to try to get her out of here as fast as possible. Let's move her to a highly visible place in the shelter. Let's put her on the surgery schedule right away so she can get spayed tomorrow. And so she can leave as soon as she gets adopted. she's going to get sick if she stays in here longer. And so don't wait till she's been here for several days to take action. Let's be proactive. She doesn't need to go into a stray holding kennel if she doesn't have a stray hold. And even if she does, we can still put her up for adoption and just call her a foster to adopt, right? What we don't want is for her to sit into the shelter for extra days. We can save even one day off of her length of stay that could prevent her from getting pan-luke or upper respiratory infection. We have tons of population management and pathway planning resources on our network.bestfriends.org website. And so I encourage you to check those out. Next up is our intake space. So critical to efficiency and disease prevention is how we set up our space. And so here's a list of things that you might want to have in your intake room. Disinfectant and personal protective equipment. So gloves for sure, potentially gowns, all of those things that are going to allow us to prevent disease spread. All of the supplies related to the treatments that we're going to give. Restraint tools. Obviously, a microchip scanner, different size scales to be able to get accurate weights. We'll have our refrigerator, and we'll have a computer for data entry, right? Because documenting all of this is important, and we'll keep our woods lamp there. This picture is an example of a room, and what I want you to notice about this room is there's not a lot of stuff in it. It's not very cluttered. This room is great in terms of being able to disinfect between animals. We see shelter disease associated with intake rooms with cross-contamination that happens early on intake. And frequently it's because we're moving too fast and we're not disinfecting appropriately between animals. Intake forms and software. So we want to have software templates or forms that support an efficient and thorough intake. Some shelters prefer a paper form, but a lot of times we have to go back and put that into the shelter software later. And so my recommendation is if you're using a software, figure out ways to just put it directly into that software. Do you actually need that written form? Most of the softwares have different template options you can use and that even have a standard healthy pet intake exam as a template, or you can create one. When we are taking in hundreds of pets each week, every minute matters. And so shaving off that time is huge. Next up is about reducing stress. This is important for all animals, but especially the cats in our care. And so ideally, we're separating and we have separate intake areas based on species. And it's not just about cats seeing dogs, it's also about cats hearing dogs. Whenever I walk into cat spaces in the shelter, I listen. Can I hear a lot of barking dogs? That is profoundly stressful for cats. Can we do things like cover their traps or carriers? Can we elevate their traps and carriers? Cats like to be high off the ground. These are all things that will help to reduce stress in our cats. And can we use low stress handling techniques? And so you can see in the image there, scruffing cats, that is the restraint technique that many of us were taught back in school, but we no longer recommend scruffing cats. And we can do things like towel wraps that are much less stressful for them. And so why does this matter? And I would share with you, while these techniques can certainly take some time to perfect, they ultimately are faster in the long run. And this is better for staff. It also means fewer injuries to your staff, and that is also better for staff. And they're better for cats. So the way that a shelter handles a cat at intake can affect that cat's behavior in the shelter. And we know that stress is related to upper respiratory infection in shelter cats. And so not just their behavioral health, but their physical health too. How we handle cats matters. And ultimately, all of this rolls up into life-saving, right? And so low stress handling, it is better for life-saving. Next is biosecurity. And so biosecurity is just preventing the spread of infectious disease. And animals at intake can be, again, like I said, a huge source of cross-contamination. And even though they look healthy, they can be shedding infectious disease. They're a high-risk group. And again, we see shelter disease that we attribute to cross-contamination, either in the intake room or on the animal control vehicles. And so this is about hand hygiene, full hand washing, or wearing gloves. And I recommend gloves because I know if somebody is wearing gloves, I can see that personal protective equipment. I don't know if you've washed your hands thoroughly. If we're doing any close handling, this might be gowns or a towel or blanket. You can see in the picture with the dachshund. So this dachshund is actually getting induced for surgery, but the technician in the photo, she doesn't have a full gown on, but she did just put up a physical barrier with that towel. So she's reducing that contamination. Making sure we're putting on and taking off that equipment so we're not contaminating ourselves and that we are changing it in between animals. We want to disinfect our intake areas in between those animals or between those families. And this was a sign I'll just share, so must use PPE. So for vulnerable populations, for high-risk populations, like all puppies and kittens, potentially all new intakes, and sometimes in really high-risk shelters, it means full PPE for every single animal. This is a shelter that we consulted with on a distemper outbreak. all of their dogs were developing distemper and were developing clinical signs at about 10 to 14 days into their shelter stay. And that is the common period, the incubation period for distemper. These dogs were likely getting exposed either on the animal control truck or in the intake area. And we found that that area wasn't reliably getting cleaned in between animals. So let's talk about sanitation very, very briefly. Also, an area where we have a ton of resources on our network website, and I'll share some links to those too. But the keys here, we want to be using the right product. And I say the right product because even products that are marketed as effective against parvo that have names like Parvosol, these are quaternary ammonium compounds, also called quats. They do not reliably kill parvo. Independent research has found them to not be reliably effective. These are not products that we should use. Again, lots of resources if you want to know what products do work, but ensure that it is a product that is effective, that we're using it at the right dilution, and then that we have the appropriate contact time. So here's an example of a ringworm, or of a microchip scanner that was taken into a ringworm ward and then came back out and was spritzed with some rescue. And rescue is effective. And so at the right dilution with the right contact time would be effective, but you can see half of that microchip scanner does not actually have any rescue on it. And so we need to make sure we're making full contact with all of the surfaces that we care about. Remember, the things that you do at intake protect pets from deadly disease. They get pets on the pathway to healing, and they start pets on that path to a live outcome. The things that you do at intake, they save lives. And every single one of you, you're all lifesavers. And what you do at this critical moment, that matters. We have tons and tons and tons of resources for you if you want to learn more. So we have a long form webinar, as well as on disease prevention, as well as several shorter videos, 10 to 20-minute videos for staff training on specific topics. And you can check those out on our shelter medicine series on YouTube, and that QR code will take you there. We also have ones on specific diseases, as well as some behavior. So lots of really great stuff there. And I'll give you this QR code again. And if you're wondering, oh my gosh, I just need you to give me a protocol to tell me what to do on intake, we have that for you. And so we have sample protocols here at this QR code, as well as some basic medical templates, protocol templates for a lot of the common shelter diseases that we see, and some other resources for you. One last poll. Don't worry, I'll give you the QR codes again. Of the things that we talked about today, if you're not doing them already, what will you implement first? Intake vaccines? Maybe you'll train some staff to do those intake exams. You'll get your vet to do that. We will ramp up some biosecurity and disease. Maybe you want to work on stopping routine FELV, FIV testing. Maybe you'll start pathway planning. Or if you want to try something else, please put that in the chat. I love biosecurity and disease prevention, some pathway planning. I'm watching the results trickle in. And we have resources to help you with all of these things. All right, I'll go ahead and end it, and we'll share. And so this is what some of you are committing to. And now, for whatever you put in that poll, put in the chat, what's the first step? So maybe you want to revisit your intake protocol. And your first step is going to be, I'm going to download that sample intake protocol that you gave me that link to, and I'm going to adapt it to my shelter. Or maybe it's, I'm going to go order some thermometers for all of my refrigerators. Or perhaps it's, I will schedule time for my staff to watch these disease prevention webinars, or to watch the recording of this, which we'll send you after this. So commit to your plan, share with us in the chat. I want to know what all of you are going to go do after you leave here. And with that, I promised you the QR codes again, so I will put those up here. So the top one is the links to all of our training videos, or recorded webinars, or recorded short videos, as well as links to all of our sample protocols. And if you need help, if you have questions, if you're wondering, oh my gosh, Does the vaccine that I'm using, is it a modified live? Is it something else? I need help. I don't know how to interpret this. Please, please, please reach out to us. Our team, our National Shelter Medicine team, is here to help you. And so reach out to us at this email address and we can answer those questions. If you're seeing a lot of disease, if you want advice on your intake protocol, we can help you with all of those things. So please reach out. I'm going to leave those QR codes up so you all can snag them. And then I'm going to open up, let's see, we have 5 more minutes to check out any additional questions that we might have and or cover anything that folks have asked already. One of the questions on here is going to be, how do you suggest faster intake times while also using good disinfecting techniques? And in here, Nikki talks about rescue needing 5 minutes of contact time in between animals. And if you have 10 intakes to do, that's an extra 50 minutes to the intake process. And so absolutely right, this can be challenging. And so if I went back to that picture that had the puppy on the scale, I start to think about things like using physical barriers. And so that puppy on the scale, there was newspaper laid out on the scale. And so trying to think about ways to reduce cross-contamination through the use of physical barriers. So for us, it's gloves, right? Gloves and potentially gowns, but can we just lay out a towel that protects the whole table where we're doing that intake? Or can we lay out newspaper? Think about physical barriers or think about utilizing different spaces. Other questions? So as we're waiting to see if anybody else has anything, I would just say, so you all will get a link to the recording of the webinar. So feel free to share that with your staff. If we will get a recorded version uploaded to that YouTube playlist and to that series. So that will be available. And so you can share that with your staff. Please do use this for training, show it to all of your staff, utilize all of those resources, and do reach out to us if you need help with anything. We are here to support you. And with that, let's see. Oh, I have one more question. So what would you suggest is an ideal quarantine period for new intakes? I'm so glad that you asked this. None. We do not recommend routine intake quarantines. Intake quarantines essentially prolong length of stay for animals in shelters. And that, in fact, is just increasing the risk of exposure to infectious disease. And so we do not routinely recommend quarantines for animals coming into shelters. Our goal is to get them out of the shelter as quickly as possible. And so we do not, like I said, recommend routine intake quarantines. The only exception to that would be if you know you have exposure to an infectious disease. So say they came in from a household where we know there's parvo or pan-Luc, or they came in on a transport and there was cross-contamination. And so in those situations, we might want to quarantine those animals or at least watch them very closely, not risk exposing others. Potentially they can still be available and they can still leave the shelter with a waiver. Because again, if they do break, I don't want them to expose others. But what we don't want to do is routinely hold animals for quarantines in our shelters. We want to get them out as quickly as possible. So thank you, Nikki. I'm so glad you asked that. All right. If you have any other questions, feel free to email us at thatsheltermedicine@bestfriends.org. We are here to help and support you with anything related to shelter medicine or population management. Check out all of the resources that we've shared as well as on network.bestfriends.org. And thank you so much. And we are doing these webinars once a month. And so I hope to see you in January for another great topic.